knows we're getting recorded. Ansley, can you, and I didn't even introduce myself, but I think most of you know who I am. I'm Elisha Giorgio. I'm the president and CEO of Global Health Council. Okay, so I'm going to go through these slides. Yeah, okay. So next slide, please. So essentially, we're gonna, run through welcome logistics about GHC, who I think most of you know who GHC is. So we'll go through that pretty quickly. Um, what is WHA? Some quick facts about this WHA, and then who's going to be on GHC's delegation. We did do a raffle for passes, so we'll share that information. A look at the WHA agenda, which, as every year, is quite packed, and how you can engage, whether you're there in person or you're joining virtually, and then some useful links. And then, as I said, we'll go to Alex and to Molly to dig in a little deeper on a couple of the items. Next slide. GHC, you guys, I think everyone here is a member or has interacted with GHC already, so you know that we are a community of individuals, organizations that believes in equitable, inclusive, and sustainable policies and investments. Those are essential to progress. And we bring that and our network and the collective voice together for things like WHA, for advocacy around US health assistance and multilaterals. Next slide. Okay, so what is WHA? It is where the decision-making body of the World Health Organization meets. It meets to determine policies of the organization, appoint the Director General, supervise financial policies, review and approve a program budget. And every time there is a WHA, every year, there's a specific agenda that's prepared ahead of time by the WHO Executive Board, and there is always an executive board meeting at the beginning of the year, usually around late January, February, that meets to determine the agenda and review items. So WHA then happens annually every May, and official proceedings occur in this place called the Palais des Nations. And this year, that's happening, but it's under construction perpetually, apparently under construction for those who have been going to WHA for the past couple of years. But this year, there's going to be some of the proceedings taking place at WHO headquarters because of the construction going on at the Palais. The delegations that attend are from WHO member states, non-state actors like in official relations like GHC. We, as non-state actors in official relations, are allowed to make statements on selected agenda items, and Global Health Council always either leads or joins statements every year on topics of interest. Next slide. Okay, so you probably know these things already, but it's happening very soon, May 18th to the 23rd. There's a timeline for official proceedings. Every WHA, I think, that I've been to in the past several years, there's always a sort of pre-caveat that they're going to limit evening sessions. And every year the agenda goes off track and off schedule, and there is later and later sessions that happen. NSAs and official relations, like GHC, are allowed to bring 6 delegates. And we'll talk about who that is in a minute. All sessions will be live streamed. We'll share the link for that. There are official side sessions done in conjunction with WHO or member states, and then there are unofficial side sessions, which many of you have been engaged in or been a part of creating or participating in over the years. Some of those are virtual and in person. Some are only in person, of course, in Geneva. Next slide. Okay, so who's going for GHC's delegation? I'm going. And then we raffled, we did a raffle of our other passes. And the way we do that, of course, for those that participated, is we send out a call for people to put in their names. And then once we have everybody's names, we use a random number generator to pick people at random. I would say this year we had quite a few stops and starts on the choosing of delegates, and we had to go back to the random number generator quite a few times because either people weren't able to go or they had to drop out at the last minute. And so this is the delegation that we have ended up with. Very happy to have everybody that's coming, and looking forward to working with everybody that's going to be with us. Next slide. Okay. So, as I said, the agenda for WHA is pretty packed. This is actually a slide that was shared with the non-state actors in official relations during an information session. We can put the link to the actual agenda into the chat. Let me just grab it and drop it in, so that you'll be able to see everything. But just to say, there are a lot of topics of interest, probably to the GHC community in this agenda. So, as you can see at the beginning, there is a focus on malaria and communicable diseases. That includes tuberculosis, that includes an immunization agenda 2030. Polio is on there as always, and you can see that is on the standalone. There's quite a bit of focus around recommitting to making progress on these disease areas, which I think, at least for those of us who are following United States moves in global health, we're quite worried about resurgence of disease in many of these areas. So it's good to see some political will being thrown that way. There's also on the agenda non-communicable diseases and mental health, and primary health care under the UHC agenda, as well as health workforce. And I believe in that health workforce section, there is discussion of a global action plan around health worker recruitment. I know I'm not saying the name of that exactly as it is written, but I know there are folks on here following that piece. We also have digital health, sustainable development goals, global action plan on antimicrobial resistance is on the agenda as well, and quite a few other things. There's also a strategy on the economics of health for all, which has been in draft since last year, and is also, I think, going to be, could be a big deal if it gets put into practice. But it really looks at the cross-sectional way that economies develop and health is included or not included, or the implications on health. And so it does have some concrete asks of member states in there. And of course, we have the pandemic agreement and global health architecture, and there is always as well a financing and program budget component to WHA, which I have not seen the drafts of that yet. I'm not sure if they're up, but that is always a big discussion. And just to say, the way, for those who are not as familiar with WHA, the way WHA works is there is a plenary session always, but then there are two committees, Committee A, Committee B, where these topics are divided. This year, Committee A is taking on, I would call it, quite a bit of the sector-specific health areas. So the malaria, communicable diseases, UHC. Committee B is looking at sort of more of the infrastructure pieces around finances and other components at WHO. That's all split, and you can see in the agenda where it falls in each committee. And we'll get into this more in detail when we hear from Molly and Alex about the two components. And then if there's time and others want to come in and talk about pieces that you're particularly interested in, I know some have really been following this economics of health for all, as well as all of the universal health coverage pieces, which this year are looking actually a lot at tertiary care and access to tertiary care, as well as looking at action plan on rare diseases. as well as I think some ethics around transplantation and human cells. So kind of an interesting piece in the UHC that I don't think we've seen a lot of focus on. Okay, next slide. Okay, so how can you engage? So if you're in Geneva, obviously you can attend as many unofficial side events in Geneva as you can squeeze into your schedule. There's also always opportunities, like at any big meeting, to meet with colleagues. There's lots of networking, receptions, and all of that. Also great always to meet with member state delegates if you're able. Um, and then if you are able to go into the Palais with a pass, you can in person monitor member state negotiations and make statements on the floor if you have joined those through your NSA. And then virtually, of course, you can amplify statements through social media, key messages, the same thing, events through social media. There is a live stream of all the proceedings and it is recorded. So if you can't get up at 3 a.m. to begin your day with those of us in Geneva, you can always check it out later. But you can certainly watch the official proceedings on agenda items that are of interest to you through the live stream. And we will, as GHC, send out a pre-WHA email as well as post-WHA, and we will schedule a post-WHA debrief where we'll be able to get into a lot more of the details of several different topics and not just PABs and global health architecture. And then, like I said, there are often hybrid side events. Again, time may not be on your side there, depending if it's a breakfast session in Geneva. Again, you might not want to get up for that, but there may be other events that you can participate in virtually. Next slide. Okay, so just here's a list of some useful links. And again, we will send this out afterwards. But WHA does have a site where all of the agenda, supporting materials, any decisions that get made are all kept on one place. And that's the first link. The live stream link, as I said, is also available through that WHA79 page. And then you can see as well through that WHA79 page the official side events. Great resource for non-official side events is the UN Foundation's World Health Assembly site, which we put in there, and the Global Health Calendar also contains WHA side events. Next slide. Okay, that was it for me. So I know we ran through that quickly, but really wanted to leave time for discussion and questions and to really let everybody share their interests and where you want to see GHC show up or ways we can support the various agenda items that are of interest to GHC's community. But with that, I'm going to first turn it over to Alex and then to Molly. And let's just hold questions until both of them have finished. But if you have a question you want to tee up, you can certainly put it into the chat, and we will track that. So please, Alex, over to you, and maybe just introduce yourself as well.
Of course. So, hello everyone. It's nice to see everyone online. My name is Alexandra Finch, and I'm a senior associate at the O'Neill Institute for National and Global Health Law. That's based at Georgetown University in Washington, D.C., where I'm also an adjunct professor of law. But I've also been representing the Panel for Global Public Health Convention in new processes in New York, but also in Geneva. So the PABs and the Pandemic Agreement negotiations. So I've been very close to these negotiations over quite some time. So I think I'll just first give you an update on agenda item 13.2, which is the implementation of the international health regulation. So as I'm sure you're all aware, countries fairly recently amended the IHR, and they are now in force as of the 19th of September last year for nearly all IHR states parties, save for a couple who opted out or in a couple who sort of delayed their coming into force. And these amendments generally introduced some new principles in the interpretation and implementation of the IHR, expanded the Director General's declaration powers to include a pandemic emergency as a new sort of higher alert level, introduced some new provisions on the equitable access to health products. There's some new obligations on international collaboration and assistance, and then there's some new mechanisms that they're still doing a little bit of groundwork building, which includes the coordinating financial mechanism for the IHR and a state parties committee. The first of those is essentially supposed to be a connection mechanism for countries' needs under the IHR to available funding, and it's supposed to sort of perform a function for the IHR and the pandemic agreement when it comes into force. And the State Parties Committee for Implementation of the IHR is essentially a COP for an IHR, but WHO is still sort of fine-tuning some of the details for that, and it's going to be up to the Secretary and the World Health Assembly to really adopt the terms of reference for these bodies. But there's still some important ongoing work for these latter mechanisms. They're trying to coordinate that with WHO's team working with the IGWIG at the moment. That's the intergovernmental body working on the PABS annex, just working out how that, particularly the coordinating mechanism for financing, is going to really behave between the two instruments. But in terms of the implementation of the IHR this year, it's really just going to be focusing on implementation of the previous IHR. So when they adopted the amendments, the resolution said that they weren't going to take a look at implementation of all these new things until next year. So we won't see, for example, countries reporting on how they're implementing these new equity provisions, how they're reporting, for example. So it's going to be quite similar to how previous WHAs have treated IHR implementation. But I think the sort of bigger update is in regard to the pandemic agreement and its PABS annex. This will be dealt with under the sort of pandemic agreement agenda item. The primary update for that is on May 1st. So at the end of the last resumed IGWIG session, WHO member states agreed that they just needed a lot more time to finish negotiating the PABS annex. And so what they will be presenting to the World Health Assembly is essentially the outcome document, which is pretty bare bones at the moment in terms of what is actually agreed. And then the World Health Assembly will essentially consider continuing, well, they'll be asked to consider continuing the IGWIG's mandate, and then potentially, ideally, submit a finalized annex to the following World Health Assembly, so World Health Assembly 80 next year. Failing, well, if they can get it done earlier, they haven't ruled out the possibility of holding a special session later this year, somewhat like the special session held to begin the process of pandemic agreement negotiations in way back in, I think, 2021. But they're just very expensive to host, and so I think it's more likely that we'll see an outcome submitted to the World Health Assembly next year. Um, in terms of the substantive content of the PABS Annex, I don't know how many of you are following very, very closely, but generally there was a bit of progress made quite recently, but there's quite a lot for them to do. It is essentially a technical annex that is supposed to operationalize Article 12 of the Pandemic Agreement, which establishes the PABS system. Very technical details, but they've come to represent these bigger issues that we saw during the COVID pandemic, from inequitable access to products, the importance of rapid sharing, and so there's still quite a lot of distance on that. Except we've seen very recent some convergence, but still quite a lot of way to go. In terms of the actual issues on the access side, the main gap is how countries are going to deal with pathogen sequence information. They have a pretty good idea about how sharing is going to happen with respect to pathogen samples, physical materials, mainly because of the experience with PIP and how they've been sharing them before. But I think it gets really murky when it comes to sequence information, because there's this huge landscape of databases for sharing pathogen information. Some of them are closed and require registration. Some of them are completely open and have no conditions whatsoever. And so the idea is, how do you attach conditions for benefit sharing to the access and use of that information when you have this big variety? There's some convergence emerging on a hybrid system. I think we're now calling it a blended system. It's got a bit of a branding update. A hybrid model that countries could upload pathogen data to either a closed system if they prefer it, or another one, but there just had to be a basic set of rules that would apply to any of the databases playing in the PAB space, which would include potentially attaching a unique persistent identifier that can essentially follow the pathogen information, sequence information through whatever system through production, and so it could always be tagged as having come from the PAB system. But it gets a bit more challenging when you have to think about how to secure benefit sharing in interpandemic periods. I think it's quite clear when there are triggers like there is a fake determination, there is a pandemic emergency, but we're also talking about the other options for benefit sharing in the pandemic agreement, such as technology transfer, such as monetary benefit sharing, which can happen at any time. So therefore, what are the triggers for that? How do you trace the use of that information for that sharing? And then on the benefit sharing side, the real challenge, like I said, is around working out benefit sharing expectations outside of a pandemic with regard to access to products in a fake as opposed to a pandemic emergency. Sorry if that's jargon in the IHR, the sort of lower level, what we've had for Mpox, what we had for COVID, compared to a pandemic emergency, which is that new legal determination. And then how you would share benefits at all other times. And I think in the last couple of weeks, we've seen some quite good faith offers from some parties to negotiate around what benefits could be expected and a better sense of which kind of users of benefit of pathogen information would have benefit sharing obligations. You know, a Pfizer would have a different obligation from a single researcher in a university, for example. But where there are a lot of challenges as remaining is how many benefits are expected to be shared at all times, and who is responsible for designing these standard contracts? Is it the IGWIG? Is it the COP? And how much goes into that? Or just still a lot of distance there. So in terms of just next steps, they've put on a couple more weeks to continue negotiating. There's still, as I said, a lot to do. There's 2 weeks in July. I think they've got some dates in September and December already scheduled for this year. And generally the mood has improved, I think mainly because when they kicked the deadline down another year, there was a sense of, oh, we don't have to cave so much. We have more time to really think about these technical questions. From my personal perspective, I think it's rather disappointing that they weren't able to finish, mainly because we've known what countries' positions are for quite some time. But they are very, very technical negotiations. Everyone's still wrapping their heads around, you know, how do you build a database, a system that includes all of these various databases. Um, but these technical issues do represent, like I said before, these very political questions. And PABS is very important, not just because it is a strong equity mechanism that will right some of the wrongs of COVID, but also because the pandemic agreement as a whole can't open for signature until countries finish this annex. So the whole thing is predicated on them getting that done until countries can start signing on. So in the meantime, what can we be encouraging member states to do? I think generally a good idea would be to encourage them to approach concluding the negotiations with some level of urgency. I think hantavirus has shown us that pathogens are not going to wait for us to finish these negotiations, and COVID, Mpox, etc. That they're not going to hang around. Um, but also, I think it's possible to encourage member states to begin implementing some of the principles and content of the pandemic agreement. There's actually language in the adopting resolution for the pandemic agreement that urges member states to sort of get moving, building some of the systems that they're required to implement if they were a party to the pandemic agreement, which is, you know, developing national prevention policies and coordination mechanisms, strengthening their health systems, strengthening their health workforce, and building up some of those, you know, local manufacturing capacities and capacities to share technologies, in addition to countries sort of implementing the amended IHR. So I think that's kind of where we'll see it. I think that it's not going to be as political in the World Health Assembly as it could have possibly been. I think countries agreed that they didn't want to continue negotiating at all during the World Health Assembly. So what they will just be doing is adopting that outcome document, moving the negotiations forwards, and hopefully including in that adopting resolution some language around please get it done, implement in the meantime. So I think that's everything. Unless there are immediate questions, I might hand back over.
Thanks, Alex. That is disappointing, actually. I mean, I think it's one thing for them all to say, oh, you should get going, you should get going, but without the agreement actually in force, there's little chance of accountability on those measures. And so countries can just keep pushing kicking the can down the road, as we say. So thank you for that. Let's go to Molly and then talking about global health architecture, because of course, the lack of a pandemic agreement is a global health architecture problem. And then we'll open it up for questions as well as any comments on other agenda items that are of interest to folks who joined the Zoom. So thanks, Alex. Over to you, Molly.
Thanks, Elisha, and thanks, Alex. Loved hearing your voiceover on where we are today. Hi, everyone. I'm Molly Moss, the Director of Global Health at the UN Foundation based in the New York office, and I'm happy to speak with you about Agenda Item 20.1 on global health architecture. Here in the chat is the WHA paper that relates to this issue. Many of you on the call may know that in February, the WHO Executive Board created a mandate for the Secretariat to design a process that would bridge and link many of the recent global health reform discussions that have been happening in other places. And the idea is that this process could help kind of create a common understanding of the state of play, what countries are needing and wanting, and kind of to decide on some principles and values that could guide what will surely be many years of continued reform. Just like the renovations to the Palais are endless, so too are the renovations to the global health architecture. Our needs are always changing, and this process is meant to create some common ground on those issues. And, since February, the Secretariat has undertaken a series of discussions to consult with member states, global health initiatives like Gavi and Global Fund, as well as civil society, to understand what a process could look like. The process has not started, the process has not been decided. That's what WHA will do. And the paper that I've shared in the chat describes how these partners could come together and work on this very kind of ambitious but also nebulous project. And so what they've arrived at is a process that will produce recommendations around three objectives. The first objective is to align the mandates and capacities of global health actors. In my view, the way I read this is that it's a mandate review. And we've been watching something like this happen in New York through UN80. It's really an effort to kind of assess the landscape of partners and what they're working on and where gaps and overlaps exist. Overlaps being really important, where duplication could be reduced and efficiencies achieved. The second objective is to enhance coordination and decision making. And I think that this will result in kind of an overview of mechanisms in the global health space and options for, again, creating greater synergies, reducing duplication and fragmentation, and really having all partners rowing in the same direction. The third objective is to align financing with national, regional, and global priorities to advance national self-reliance. And to me, this reads like a landscape analysis of global health financing flows and recommendations emerging out of that about how to best support country transformation. And so, while this feels, again, really ambitious, what I've just described to me seems a little bit circumspect. And the phrase that comes to mind is that everyone wants coordination, but nobody wants to be coordinated. And I think there's an important statement in the paper that says the process will propose neither revisions to organizational mandates nor specific mergers and consolidations, which fall within the governing bodies of organizations like Gavi, Global Fund, CEPI, UNITAID, and others. This is an important caveat that just says, like, this WHO hosted process will not seek to take governing bodies' decisions for other organizations. And it just kind of signals the tension that goes around something like this. Nobody wants to really be coordinated and not be coordinated by this process, certainly. So following some interim reports on these different objectives and issues, a final report will be presented to WHA next year, WHA80. And it remains to be seen kind of what that will look like. I guess the recommendations would be endorsed if member states feel confident about that. So this work, as the paper proposes, will be carried out by a 25-member task force, which will be supported by a discrete secretariat. The secretariat has resource implications for WHO, and member states will have to think about how to financially support the effort to bring this process to life. The task force is to be composed of 14 member state representatives, 2 from each region, plus an additional 2 co-chairs, so 14 total. It also will include the principal or deputy level of global health initiatives, so Sanya Nishtar or her deputy, Peter Sands or his deputy, up until his term ends later this year. It also makes reference to including the WHO Civil Society Commission, the Youth Commission, as well as some private sector associations and product development partnerships. But as I read it, these civil society, private sector partners will be engaged as stakeholder groups who are consulted rather than core to that 25-member body. The task force ideally will operate on consensus. If consensus can't be achieved on the recommendations, those who are not consenting will, kind of have their concerns flagged in the materials. But the idea is that everyone can come together around the recommendations that will be shared. There are a few ways that this will intersect with UN80, though I will say UN80 was not a prominent feature of the paper. But there are ways that the UN in New York and member states in New York are thinking about WHO's role in humanitarian response. As country team and regional coordinator roles get kind of redefined and strengthened, that will have an impact on how WHO relates. And I won't, belabor the timeline, but it's interesting to note that kind of the initial set of recommendations will be available by late autumn and will be brought to the different governing bodies of the organizations that I've already mentioned, and that by the executive board meeting of February 2027, there will have been an important round of consultation on the initial set of ideas before being finalized by WHA next May. There are some risks to this process that are even stated in the paper, including low participation of member states, particularly LMICs. We have already seen through the spring that low and middle income countries, likely having been tied up in PABS negotiations, have not been able to engage in this process, and that a lot of the input has come from countries from the European region and other high income countries. Of course, the people who are involved may have conflicts of interest, and moving through a due diligence process to ensure that these inputs are not kind of exerting undue influence, I think will be a concern of many. For me, there are a few questions and observations that I'll wrap up with. I think this whole process, because it's abstract, runs the risk of kind of being misinterpreted. You can see the language tries to caveat that this isn't WHO trying to tell other organizations how to act or behave, or to tell member states how to approach global health governance. But I think there's a real risk as the work goes on that people will not totally understand and kind of apply their own lens to it that may or may not be accurate. A 25-person body is pretty limited, and I'm sure that if the consultations with other partners are not felt to be robust or adequate, that will become problematic. The PABS negotiations, as Alex shared, will continue. So member states' attention will be divided, and I think the possibility that they'll continue to focus their efforts on something that is more mature, the PABS negotiations, could create quite a risk for this process. And with those risks, it's like if this kind of fails, or if it only produces very incremental results, will that be seen as WHO's fault? This is, attempting to be a very inclusive process. It's very hard given the rules of engagement that WHO has. And I would hate to see that this kind of isn't viewed as a failure of all the partners who are involved, if it is in fact something that's not seen as a success. And so how can different partners help make this a success is a question that we'll be asking at WHA. And then finally, because I know I've gone on too long, we'll have a new director general next May. And so this process of kind of shaping the global health architecture, I think will entail kind of shaping the future of WHO as well. And candidates will have to position themselves around this. And I think that will be a really interesting space to watch. The person who comes in, gets agreed this time next year will be inheriting something that's very much in motion. And so he or she is likely to try to shape that without interfering over the course of their campaign and their candidacy. I'll leave it there. Happy to discuss more about the DG election if that's of interest. And Elisha, I do have some points on the financing and implementation stuff if that's of interest, but I'll pause now.
Okay, thanks. Thanks, Molly. I'd love to open it up to people if there are questions or comments. And while you can use the hand raise function, which is at the bottom of the menu bar, to come into the queue if you have a question. As people think and are coming up with their own questions, maybe I'll just pick up on your last point, which is around politics. And, I mean, Alex, you made the very astute points that there's a lot of technical pieces in PABs and people are getting their heads around that. Global health architecture is also, a political question about inclusion and who makes decisions. And really everything that happens at WHA it's about health, it's technical, but it is in the context of broader geopolitics. And I'm just wondering if any of you, Molly, Alex, or I see Camden from UNF is also online, want to maybe just talk a little bit about how you think the geopolitical environment currently is impacting some of these processes. I mean, we have several wars happening at once. Obviously, the US is not present for any of this and may be kind of the cause of many of these global health architecture pieces we're seeing, or at least seeing them expedited. So I'm just curious of how you think some of the political spectrum, scope, tensions are going to play out during the WHA week. And I realize it's personal opinions only. It's not, no one will hold you to it, but I do think it's a big part of the conversation and something GHC will be certainly watching, especially since this is the first WHA without the US there at all. Anybody want to comment on that? Molly?
Yeah, I can share a few thoughts. I mean, I think we've seen how the US is influential even in its absence. I think a lot of the global health architecture discussions have run up against bilateral compacts and the implications of that changing architecture and other ways that the architecture is changing in a non-consensual way. For the global health architecture conversations, I was saying last week that increasingly it seems to me that this discourse is between Europe and Africa. We don't see Asian countries or Latin American countries deeply engaged. And I can say that this is not an unusual trend, particularly for Latin American countries who are quite regionalized already. But it seems very stark on the global health architecture conversations and the donor-recipient relationship. So I think that's also why we see some of these more like minilateral arrangements taking shape, and we'll continue to see that going forward. And then what that means for WHO's changing role is not clear. On the conflict dimension, we've seen the implications of conflict for health come through in WHA strongly in recent years since Russia's full-scale invasion of Ukraine. And this comes in the form of hard statistics on loss of healthcare workers, on increasing rates of antimicrobial resistance, of course, in addition to, fatalities and public health implications for the populations in these conflict-affected settings. A lot of this comes down to very time-consuming rights of reply among Palestine and Israel, among Russia and Ukraine, among their proxies. And there's a lot of diplomatic process around that is why the agenda gets deeply off track. Not to say that that's not warranted, but you increasingly have countries saying this is a technical health forum. We shouldn't be talking about these political issues. Yet the lines continue to be really blurred when we have very distinct public health implications from these conflicts. So I hope that helps paint a picture. It's complicated for sure.
Thanks, Molly. And Alex, do you want to come in on this as it relates to the pandemic agreement?
Yeah, sure. Thank you. And it's a great question, Elisha, one we're also thinking about quite a lot. So I think on the PABS front, as Molly mentioned, sort of the elephant in the room is bilateral deals with the United States and a number of countries in the African region at the moment, which essentially means that there will be pathogen sharing outside of the PABS agreement, whether we like it or not. And I think the challenge is member states at the moment are kind of negotiating, blocking that out a little bit, thinking that as much as possible there needs to be sharing within the system so that there is, the biggest possible pool of pathogens, the biggest possible pool of benefits that will be shared following their use. I don't think it actually has impacted negotiations all that much because I think it's accepting that that reality is actually contrary to a lot of the negotiating positions, particularly within the Africa group, saying, we have to have a sort of more minute closed system and no leakage out of the PAB system when they actually do have bilateral contracts with the United States. So it hasn't impacted it so much, but I think where we are seeing the impacts is firstly on regionalization. So you're seeing this increased regional building of policy and also an emphasis on shoring up, meet regional manufacturing capacities, more regional approaches to policy. I think the African Union recently developed a pretty comprehensive pandemic prevention policy that covers the continent. And then on financing, a lot of the approaches on financing to this up until this point, well, up until we had the big, the United States leaving WHO and retrenching financing elsewhere, is really looking at just ways to move money around rather than generating more of it. Both of the mechanisms under the IHR and the pandemic agreement just do this, needs and gaps analysis, and then say we're going to leverage voluntary commitments wherever they may be, and we'll connect existing financing to those gaps. When really there could be an alternative conversation around why reliance on ODA is so risky, because you could have an actor rip the cord out, turn the taps off all of a sudden, and then these programs just sort of go out the window. So I think there is an opportunity to have a stronger conversation around, pandemic preparedness, PPPR as like a global public good that should be invested in. It's an investment as opposed to a real cost, but we haven't really seen so much of that. I feel like countries are feeling a lot of pressure, particularly countries with high debt burdens are not really approaching this, increased investment thing. But I think the politics of it all is that there are certain states that, we just can't rely on for providing ODA anymore.
Thanks. Thanks both. It's a tough thing to navigate for sure. Weiss, I see your hand. Do you want to come in?
Yes. Hi, everyone. I'm Waisro with Management Sciences for Health. Just to make a point that on the global health architecture discussion that, going into this, it was sold as not business as usual, that we will have a robust process that will be proposed for WHA, and that would include really strong engagement with civil society. But what came out last week really shows that, civil society is going to have little to no say in this process. And so, I'm part of a group called Here Say So. We've been doing these consultations in the lead up to this process, and we've been working with WHO very closely to shape it, and so we're trying to put together a response to this. We know for sure that WHO will go with their own processes dominated by member states, but really still raise the fact that this is not going to be an inclusive, transparent process, and try to get that across through next week. And so we'll share that statement when it comes out for sign on for adapt. You can adapt it as you see fit. The process has been really challenging in part because, as Mali said, LMICs have not been robustly engaged. The whole If you look at all of the dialogues we had, whether it's the EU EC reflections or the Welcome Trust or other processes, it's been very much dominated from or by the Global North, driven by the Global North. But that's not probably the reason why LMICs have not participated. Part of it has also has been mentioned is the it really focused on the PABs and other priorities for those countries. However, this is starting to look that, you know, in the end, we may not have, as Mal was saying, the kind of reforms that we want to see, that we need to see in this space. And I think it's something that we should all be very concerned about. Yes, this was less engagement in Asia, but they were actually quite engaged in the Welcome Trust process. Indonesia, Thailand, specifically were very, very active, and but there was still like diverging visions. The Africa group, they were looking at the regional approach, but the Asia countries were saying, no, this is not really going to work for us as an approach. So some of those things will be articulated through the next few months of this process. But just to say that there's so much to deal with. JHIs themselves, they have their own boards, they have their own decision-making bodies. It was very challenging to come up with a process that will make a decision on their behalf, or that will force them into decisions that have been made by others. So this is something we have to keep really close eyes on going forward to see what comes out of it. But a little bit unfortunate for now that civil society's voices and community voices are not going to be at the front and center of it.
Thanks, Waiswa. That's a really important point. And I would say, and Molly, I'll come to you in a second. Molly raised the transition of the Director General. And, Dr. Tedros has been very supportive of civil society engagement, started like additional civil society working group, steering committee for civil society that are not NSAs. I mean, there's always problems, there's always questions about the effectiveness and how valuable that is in the end. But the verbal support, the vocal support has been extremely important because for those of us that have NSA status in official relations, it feels to me more and more precarious, right? There are member states who really don't want to engage non-state actors in any shape or form. And we see again, like when the US is a supportive administration, supportive of WHO, supportive of public health, supportive of multilateralism, the US usually goes to bat for civil society quite a bit. And again, that is a missing piece moving forward. And so we have seen, and I think really saw the last executive board, some real, power plays by member states who have long wanted to ostracize NSAs from proceedings, from the table, decision-making table, really try and do that. And I think we'll see that continue even more. And as we watch the transition of the Director General, I think in addition to everything Waiswa said about the global architecture conversation, like that is another place where we need to be really vigilant and pay attention to whoever is the nominee or the sort of short list coming in, what their stance on is a whole of sector, whole of society approach, and that they don't further shrink the space for non-state actors. Molly, over to you.
Thanks, Elisha. I agree with everything that you've just said. It feels like there's really a simmering effort among some member states to block civil society and that they're building coalition, right? There's like more kind of energy behind this, and your observation around the US as like a countervailing force is a good one. I just want to, following Waiswa's great comments and appreciate you coming in and hearing your perspective on the global health architecture stuff, Waiswa. I just wanted to say that there is a possibility that member states will not move this forward. The decision at WHA is a decision, and that decision could be that this is a non-starter. And to that end, it's been hard. I've not heard a lot about how member states are reacting to the paper that was just shared last week. They have very little time to review and kind of develop their position on it. But it's not, I don't think it's a foregone conclusion that member states will agree and that this process will go forward. So I just thought that was worth saying. And if time allows, I'd love to ask Alex a question. I'm so glad that you mentioned the hantavirus situation currently, and I'm just really curious, how it's kind of a crystal ball type question, but how you might see this scenario bearing on PABS negotiations going forward, including just like the realities of how these cases emerged and kind of pressure testing some of the ideas around PABS.
No, great question. So I haven't actually caught up on actually that just the epidemiology and whether, it was, I think it has to do with the rat urine. And there's been a couple of human to human transmission instances there they're quite worried about, and I think about 3 deaths, monitoring it very closely. I think for me, what it indicates is that the pandemic threats are ongoing, coming from places we either have known about. I think this was identified as, the Andes type of hantavirus fairly quickly, but also it could come from new sources. So just that the pandemic threats are not going to wait for negotiators to sort of finish their work. And I think probably also highlighting the importance of really implementing the IHR to the full extent. So, the notifications, having countries participating and coordinating with WHO early in the response to a new public health emergency. But in terms of PABS, it's just really it could influence how countries are thinking about the definition of pathogens with pandemic potential, which is a relevant on an ongoing part of the negotiations. Currently, they're determining whether it's going to be sort of like a list base or some criterion based, probably a hybrid approach with a body that is a body of experts that is selected, and determining what those pathogens are. Yeah, but really, I think the primary point is the ongoing nature of pandemic threats. That's what that story says.
Thanks so much, Alex. Thanks for asking that question, Molly. We have a couple more minutes. Does anybody want to come in on any of the other agenda items we haven't touched on? I know there's quite a bit of different topics. Peter, go ahead. And you're on mute. There you go.
Yeah, thank you very much. I'm sorry to go back to the same topic here. We have been having discussion at civil societies under RANI, Resilient Action Network Africa, about the PABs and the ongoing discussions. We seem to be having feedbacks from the civil society representatives than from the government. And we have been writing some letters and we wrote to the EU on their stand. We are wondering if these messages, these write-ups and coped are being listened to, or we just have to wait and for the outcome. Because we have been giving feedback through our own advocacy notes to member states, particularly to the EU, on their stand. So I was just asking if this really come to be read, or we're just we are just acting to the social media.
Thanks, Peter. That's a great question. Is civil society being listened to, Alex?
I think yes and no. I think, Peter, I want to continue to encourage you to continue doing that very important work. I think one of the challenges we've had as civil society actors in the PABS and the pandemic agreement negotiations before them is that we weren't allowed in the room, and so it was very, very challenging to have our voices heard. But I think to the extent that if you do have contacts in member states, particularly in capitals, I think please continue on advocating. We're doing the best as we can to sort of speak with one voice, at least when we do have access to the room in Geneva, but as much pressure as you can continue at capital level, it would be really, really wonderful. I know certain civil society actors have had luck, engaging members of the press on issues. from Geneva. So yeah, please carry on. I think it's important to have as many voices as possible, even when we're being locked out in sort of more formal ways.
Thank you. Thanks, Alex. I think we are just at time, so I really want to thank Molly and Alex for their great insights on these few agenda items in a very packed week. And I know there's a lot more we could talk about, and we will schedule, as I said, we will schedule a post WHA debrief and really go into some more issues at that time. But thank you all for joining us. Keep your eyes out for an email from GHC with the recording of this, with some links and some other information. And for those of you who are going to be in Geneva, we hope to see you in person. Thanks, everyone. Take care.
Thanks all. Bye-bye.
Thank you.
Thank you.